literally just got off work. You guys can see my battle scars from my mask wearing all day. We saw so many patients with presumed COVID. We intubated a lot of patients, and it's the first day that this has felt super real to me as an ER doc. And honestly, it's pretty terrifying.
There's definitely a fear amongst the healthcare workers of, of us growing sick or seeing our peers get sick. But thankfully we have the protective wear that, readily available to us. I think what's just crazy is like the numbers rising and the acuity of the patients is like nothing we've ever seen.
We are going through an insane amount of PPE. We are reusing as much as we can. It's scary, and I just want to tell people in other parts of the country, take this seriously, because you do not want to end up like us.
No matter how many times I work a shift, the one thing that always comes to mind about this disease is how lonely it becomes. How you see old people, young people, middle-aged people just slowly wither away. And there is no family or there is no one here to just sit by their side and hold their hand. And I think that is one of the hardest things about coronavirus, how people just die alone.
Today was an absolute uptick in sort of the amount of patients that came in with COVID-like symptoms or that were confirmed positive. It was essentially exclusively all that I saw today in the ER.
You can ask any healthcare worker to name the worst shifts of their life, and hands down, today would definitely qualify as top 5 for me. Probably top 3. We are under an immense amount of stress. PPE is dwindling so much. I don't know how we're going to make people understand that this is serious, that people come in walking and talking, and then they end up on a rapid decline, and we have no rhyme or reason why.
And it feels like playing dominoes every single minute over 10 hours straight. Feeling like any one of your patients is about to fall and collapse. I'm exhausted, but I couldn't feel prouder of the team we have in this department and for what we're doing as a health system and really as a country. We are overcoming so many major hurdles, but there's only one way to do it. There's only one direction to go, and that's forward.
I think that I've seen more intubations in the past couple weeks than I have in the past number of years that I've worked here. It's the moments that break your heart right now. When you come across that patient in the car line who is so ill and they have to come inside and they need rapid intervention right now. They have this moment where they look at that family member that drove them there, and they're both wondering, am I going to see this person again? That's not something that I ever wanted to be a witness to. Every single nurse, every single physician, we're committed, and we put our life on the line every day because that's what we do, and that's what nursing is.